That was really weak today. Welcome to the Committee on Health and Human Services. Secretary, will you please call roll?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadeem, Wynn, Orntlicker, Chair Brown May.
Here. Thank you so much. Thank you and welcome to all of you in our audience today. Welcome to the Assembly Committee on Health and Human Services, everyone here in Carson City, everyone in Las Vegas, and everyone joining us on the internet or online. As a reminder, please remember to silence your electronic devices. If you wish to testify today, please sign in at the table by the door and provide a business card to our committee secretary. When testifying, remember to turn on your microphone and clearly state and spell your name and any affiliation that you have for the record. Members of the public may provide testimony on a bill, either in person or by telephone. To do so, you will dial 888-475-4499, and then when prompted, provide the meeting ID. Today is 853-8032-8311, and then press the pound sign. We'll repeat that again as we move into public comment. Our meeting agenda and committee information is available on Nellis, which can be accessed through the legislative website. You can also watch our meetings there or through the legislator's YouTube channel. Public comment today will be taken at the end of our meeting, and each person will be limited to 2 minutes. We expect courtesy and respect, as we are all here to share our opinions today. Committee members will be using their laptops or other electronic devices to view handouts. Please don't view that as a sign of disrespect. We have a very robust agenda today. But I am very excited to welcome up first the University of Nevada, Reno School of Public Health for their presentations. Please feel free to come forward.
Thank you, Chair Brown May and members of the committee. Megan Kamlatsi, Director of Public Affairs and Policy for the UNR School of Public Health. Thank you. It is with heartfelt gratitude that we are here today to share with you our finalists in the UNR School of Public Health's This is Public Health competition. It was a competition in which students were challenged to communicate with policymakers and the public what public health is, why it matters, and the value it adds to our communities in just a few minutes. So the students could choose to talk about public health broadly, or they could choose a specific public health issue to communicate about. We have 3 finalists today, and I'm pleased to turn it over to Emma De La Torre.
Hello, my name is Emma De La Torre. Do I need to spell my name? E-M-M-A, and then lowercase d-e, space lowercase l-a, space capital T-O-R-R-E. And I am currently a junior at the University of Nevada, Reno, who's majoring in public health. So as someone who is majoring in public health, I often get questioned, what even is public health? And usually I say it's the reason you're not dead. And and those who are in public health are like, yes, that makes total sense. But I very much confuse those who are not. And I came to the realization that people interact with public health every single day, yet they don't clock that they're interacting with public health. So with my presentation, the invisible shield, the unseen everyday impacts of public health, I wanted to demonstrate the everyday impacts that public health has on us and has on our safety and has on our well-being and our livelihoods. So with my poster, I put what public health impact we have. So for example, it shields us from infectious diseases and preventable illnesses. And that is, of course, vaccine programs. So with my poster, I wanted to show the impact that we see on an everyday basis. For example, we can cross the road and not really worry about being hit by a car most of the time. Or when you take that breath in, you're not breathing in air that has lead in it because we banned leaded gasoline in the 70s. But the everyday impact that we see within public health is so important. It is an invisible thing lurking in the shadows that shields us from great danger. It's always there, it's always present, and even if we don't see it, it's working to benefit us, and it is working to protect us. Public health is always there. It will always be there, protecting us. We put on our public health armor every day we wake up and every day we go to sleep. Every breath we take, every sip of water, every moment of our day is impacted by public health. Thank you.
Good afternoon. My name is Kyle Edison, Kyleedison. I'm a MPH student epidemiology at the University of Nevada, Reno, and today I'm going to be talking about hidden threats of vector-borne diseases within Nevada. So what is a vector-borne disease? A vector-borne disease is an organism, such as mosquito or tick, that transmits disease. As you can see here on this flow chart, diseases can spread between different vectors, mosquitoes or ticks, and then also can spread to humans, which can cause death or severe illness. In good scenarios, sometimes it ends with humans, animals, or dogs. It can end there. However, most commonly, it will spread through the entire animal system and then end back up with humans again. So internationally, this is a threat. Mosquitoes kill about more people than any other animal on the planet. They kill over 1 million people each year, costing about $12 billion. 60% of all current infections globally are from animals. And in the US, vector-borne diseases has quadrupled since 2004. So Nevada was safe in the past. We had two populations, mainly Las Vegas and Reno. We had strong supply chains, and we had the CDC to really back us up. And also, we just had pure luck. So are we still safe? Sadly, we're not. Things are changing. The climate's changing. The environment's changing. We see the population of both Reno and Nevada. Since 1970, our Nevada population has expanded sixfold. This means that people are becoming more close contact with animals, expanding into more rural areas, increasing the perfect environment for certain species of mosquito, like Aedes aegypti, which spreads most vector-borne diseases and it can be highly deadly. Also, we see the federal support declining. We don't see this federal support from the CDC that we saw in the past. And with these adaptations and these different environments, we can expect certain things, especially with pet ownership increasing, that we can see these diseases get closer to humans, which will pose more of a threat. Even with the legislation we have, Nevada has some of the most relaxed exotic animal trades, and we have no control over tire imports as well as plant imports into the state that I know of. So what are local health departments doing? In the past, we've done pretty well, but things, like I said, are changing. Inadequate staffing and rising cost of resources. Before, it was about $3 per pound for dry ice, which we use to attract the mosquitoes for testing. Now it's gone to $5 per pound, and we use about 500 pounds every 2 weeks. And with the changing climate, we see that the overall season for vector is also increasing as well. So we need more resources and more amount of time. And when there's no management of any certain vectors, such as ticks. So, unlike other states, Nevada doesn't have a state-level system, and the CDC poses these issues to us. They can't work with individual counties as well because some counties want help, some don't. This has caused temporary solutions, and overall will lead to more issues later down the line. Furthermore, with no state level, we have no shared data, no unified response, and no standard of testing, especially with pesticide testing. Some counties haven't tested for many, many decades, and this is a huge issue as other parts of the country see pesticide resistance growing. So what would a state level do? At the state level, we can see collaboration in testing, abatement, and pesticide. We can see more leverage with these pesticide agencies as well as the CO2 companies. And I think that most importantly, we can give direction. Currently right now, each county, each abatement district does their good share, but they do random things. Nothing's united. With a united force, we can have a head point. We can charge forward and make actual change that lasts longer. So the illusion of safety is over. Proactive action must be taken to protect future generations. With a state-level vector-borne department, we can help protect not only people now, but the generations going into the future. Because the most important thing we could focus on is creating the better infrastructure that can stay stronger, especially as the times are rapidly changing. Thank you for your time.
Hello, my name is Alexis Ellis, spelled Alexis space ELE. On behalf of all of the UNR students here today, we'd like to thank Chair Brown May and members of the committee. Thank you for the invitation to present before you today. Today, I'd love to shed some light on a very silent crisis going on in public health through a patient that I named Declan. First, I'd like to put you into perspective. You're a doctor treating Declan's symptoms. He complains of headaches, chest pain, and insomnia. How would you treat him? Painkillers, heart medication, maybe he needs to do some testing like an x-ray. And oftentimes that's quite appropriate. But what if I told you that these symptoms weren't caused by physical illness at all? I'd like you to think about what your typical visit to the hospital looks like. Typically, we just look for a cure to our symptoms, anything to make the physical pain we're suffering through go away. You might be inclined to think that Declan's physical symptoms, his increased heart rate, headaches, and insomnia, are what make up his diagnosis. But the reality is, hospitals miss mental illness diagnosis in more than a quarter of patients. What we don't see about Declan is that he suffers from depression, anxiety, and suicidal thoughts. Now, it's true that majority of the population doesn't have to face these mental illnesses, with an estimated 3.8% of the population experiencing psychological conditions like depression. But of these small populations who do, healthcare providers are equally responsible to such a vulnerable population. Yet misdiagnosis remains a significant issue. Either mental health conditions go undetected entirely, or common physical symptoms are mistakenly attributed to psychological causes. Declan's story represents millions of Americans whose mental health conditions go undiagnosed or untreated. These invisible scars are symptoms of a larger public health issue, one that requires system-wide change. It's more than just misdiagnoses. It's about barriers to care, like stigma, limited access to mental health professionals, and financial challenges. Declan is a powerful reminder that treating symptoms isn't enough. This is where public health steps in, preventing problems before they occur and understanding how factors like access to care, social support, economic stability, and community resources shape mental health outcomes. Public health policies can strengthen mental health screenings, fund prevention programs, and make sure resources reach those in need. These people can be the people next to you, your classmate, or our very own community who live on our streets. So, how could Declan have been better treated? Through the use of community-based mental health services, integrated behavioral health programs, and policy changes that mandate mental health screenings to catch his symptoms sooner. Public health doesn't just treat individuals. It protects populations, builds resilient communities, and creates environments where mental health can thrive. I'd like to leave you off with the fact that public health is prevention. It's about creating policies, mobilizing resources, and championing mental health as a priority. When we invest in mental health, we invest in healthier, more productive communities. It's time we make mental health prevention as common as washing our hands, because even when our mental scars are invisible, they are just as painful as an unhealed wound, persistent, lingering, and deserving of care. Thank you.
Thank you all for your wonderful presentations. It's really been an honor to have you here with us today from the School of Public Health with the University of Nevada, Reno. Your hard work does not go unnoticed. We appreciate that you have taken the time to come and share your posters. I understand that you are the top 3 presenters in the school currently. And so congratulations to each of you. Thank you for taking the time to come and share that with us today. That's the future of public health right there for us all, right? So thank you so much for being here. Members, we are going to move into a work session. So we have a number of measures that are on our agenda today. All of the measures have been previously heard, and it's not customary for us to take testimony or otherwise rehear bills during a work session. We may invite a witness to come forward if we need additional clarification. But for now, we're going to go ahead and start with Assembly Bill 161, which makes revisions relating to hospice care. Mr. Florence.
Thank you, Chair. Davis Florence, Committee Policy Lines for the record. Assembly Bill 161 was sponsored by Assemblymember Edgeworth and was heard on March 5th. Due to the substantial amendment, I will skip the bill summary and just go to the amendment. So the amendment that Assemblymember Edgeworth submitted, and it is attached to the work session document in front of you. In summary, this amendment proposes to remove sections 1 through 11, 13, 15, 16, and 19 in their entirety, and also remove and revise certain portions of sections 12, 14, and 17 to do the listed items through A through F. The amendment additionally adds in section 14 additional requirements for hospice care programs, including that they must notify the patient when the program has initiated filing claims for benefits on their behalf, providing written notification to the patient of all the contact information for the provider of hospice care and the times that they may be reached. And if a program chooses to terminate care, they must provide a minimum of 7 days' notice to the patient so that the patient can adequately arrange for the continuity of care. And lastly, they must provide the patient with information as how to file a complaint against the program with DBBH. Thank you, Chair.
Thank you. Members, are there any questions on Assembly Bill 161? Seeing none, I will entertain a motion to amend and do pass Assembly Bill 161. I have a motion by Vice Chair Nguyen, second by Assemblymember Edgeworth. Is there any discussion on the motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay? Thank you. Motion passes unanimously. We will give that floor statement to Assemblymember Edgeworth. Thank you. Next item up on our agenda is Assembly Bill 176, which revises provisions relating to reproductive health care. Mr. Florence.
Thank you, Chair. Assembly Bill 176 was sponsored by Assemblymember Torres and was heard on March 19th. Assembly Bill 176 generally prohibits a governmental entity from enacting or implementing any limitation or requirement that singles out reproductive health care and substantially burdens access to services or the provider's ability to render care. Assemblymember Torres Fawcett submitted the attached amendment that proposes to revise the name of the act to the Right to Contraception Act. Second, it revises the definition of governmental entity to exclude the State Board of Education, the Department of Education, the Board of Trustees of a school district, the governing body of a charter school or a university school for profoundly gifted pupils, and a public school. Third, it clarifies the provisions of this bill do not apply to the activities that take place at a school or as part of an activity sponsored by a school or school district. And lastly, it excludes abortion from the provisions of this bill. Thank you, Chair.
Thank you. Members, are there any questions on Assembly Bill 176? Go ahead.
Clarification for the questions.
Do you have a question relative to this, or do you have a disclosure?
Just a discussion after the motion. I apologize.
Okay, no worries. Okay, then seeing no questions, I will entertain a motion to amend and do pass.
So moved.
Motion by Vice Chair Nguyen. Second. Second by Assemblymember Gonzalez. Members, is there any discussion on the motion? Okay, Assemblymember Hafen.
Thank you, Chair. I apologize for that. I was reviewing the amendment, and I want to thank the sponsor of the bill for the amendment. I believe that all my concerns have now been alleviated, but I am going to vote this out of committee and just reserve my right after I see the final version of the amendment. But I did want to go on the record thanking the sponsor for the hard work and addressing the concerns of all the stakeholders. So thank you.
Thank you. Any other? Okay.
Thank you, Chair. Just a very quick ditto. I've just retained my right, but I will be a yes.
Thank you. Okay, seeing no other, I will entertain a motion to amend. We did that. Thank you. Okay, all those in favor say aye. Aye. Any opposed, nay. Assemblymember Gray and Assemblymember Edgeworth are nay. Thank you. With that, motion carries. We'll give the floor statement to Assemblymember Torres Fawcett. Next item on our agenda is Assembly Bill 337, which creates programs related to dementia. Mr. Florence.
Thank you, Madam Chair. Assembly Bill 337, which was sponsored by the committee on behalf of the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs, and this bill was heard on March 17th. Assembly Bill 337 requires the Aging and Disability Services Division to establish and administer a program for dementia care specialists. Additionally, this bill authorizes the medical schools of UNLV and UNR to collaborate with the department to establish the Nevada Memory Network. Allison Herzig, the Director of Nevada Government Relations with Dignity Health St. Rose Dominican, proposed the attached amendment, which requires DHHS, UNLV, and UNR to contract with community-based health programs that provide support and care for people with dementia and their caregivers. This amendment aims to proactively support people with dementia and their caregivers if the Nevada Memory Network is established. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions on this Assembly Bill 337? Seeing no questions, I'll entertain a motion to amend and do pass AB 337.
So moved.
Motion by Vice Chair Wynn, second by Assemblymember Hunt. Is there any discussion on the motion? Seeing none, all those in favor say aye.
Aye.
Any opposed, nay. Motion carries unanimously, and we will give the floor assignment to Assemblymember Hunt. Next item on our agenda is Assembly Bill 338, which revises provisions relating to health care for senior citizens. We'll turn it over to Mr. Florence.
Thank you, Chair. Assembly Bill 338 was sponsored by the committee on behalf of the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs. This bill was heard on March 17th. AB 338 requires DHHS to apply for the necessary federal authority to amend its home and community-based services waiver to include attendant care services for frail elderly people. The Division of Healthcare Finance and Policy must collaborate with the Division of Public and Behavioral Health to establish an internet website to facilitate the connection between personal care service agencies and people in need of those services. And there are no amendments for this bill. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on Assembly Bill 338? Okay, seeing none, I will entertain a motion to do pass Assembly Bill 338.
So moved.
Motion by Vice Chair Wynn. Second by Assemblymember Gonzalez. Any discussion on the motion? Seeing none, all those in favor say aye.
Aye.
Any opposed, nay. Hearing none, the motion carries. And we will give this floor assignment to Assemblymember Jackson. Next on our agenda is Assembly Bill 339, which creates the Office of Children's Mental and Behavioral Health within the Office of the Director of the Department of Health and Human Services. Mr. Florence.
Thank you, Chair. Assembly Bill 339 was sponsored by this committee on behalf of the Joint Interim Standing Committee on Health and Human Services and was heard on March 24th. AB 339 creates the Office of Children's Mental and Behavioral Health within the Office of the Director of Health and Human Services. The office is required to perform various duties relating to the mental and behavioral health of children. Additionally, this bill eliminates the subcommittee on the mental health of children and instead requires the office to develop a statewide plan for the provision of mental and behavioral services to children. There was an amendment submitted by Assemblymember Goulding in collaboration with the Children's Advocacy Alliance, which is attached to this work session document and proposes to add provisions in Section 5 concerning the qualifications of the director of the office. Additionally, it revises Section 6 to require an annual report on the progress of the statewide plan to go to the director of DHHS and the director of the Legislative Counsel Bureau. It requires the office to publish a report and provide a presentation on the capacity and readiness of the state to implement a Children's Behavioral Health Center of Excellence, and it directs that office to seek approval from DHHS for the establishment of the Center for Excellence. And lastly, this amendment authorizes the office to employ the following listed positions. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions on Assembly Bill 339? Seeing none, I will entertain a motion to amend and do pass Assembly Bill 339. Motion by Vice Chair Wynn. Second by Assemblymember Gray. Members, is there any discussion on the motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We will give that floor statement to Assemblymember Nadeem. Next on our agenda is Assembly Bill 360. Yes? Which revises the provisions relating to testing for sexually transmitted diseases, and we'll turn it over to Mr. Florence.
Thank you, Chair. Assembly Bill 360 was sponsored by Assemblymember Goulding and was heard on March 12th. AB 360 requires certain health facilities to test pregnant women who have not received required prenatal screenings for syphilis using a rapid test instead of a standard serological test. Assemblymember Goulding also proposed the attached amendment, which in summary proposes to amend Section 1 to add physician assistants, advanced practice registered nurses to the list of healthcare providers this bill applies to. Second, it removes provisions stating that screenings and tests are to be recommended by the American College of Obstetricians and Gynecologists. Third, clarify that an examination for syphilis can be made with either a rapid or a point-of-care test. A standard serological test may be used if the facility can obtain the results before the woman is discharged. Fourth, it removes the phrase trimester of pregnancy at the first to instead require a syphilis examination to occur at a woman's first visit, regardless of the trimester of pregnancy a woman is in. Fifth, it requires the director of DHHS to seek all necessary federal authority to reimburse hospitals and providers for performing rapid or point-of-care tests for syphilis that are covered by Medicaid or presumptively eligible for Medicaid. This reimbursement must be approved as a separate encounter from the rate that's currently bundled by Medicaid. And then lastly, this requires certain facilities to develop a policy that complies with NRS 442.010 that's amended by this act to align with the best practice prenatal screenings and the tests that are recommended by the American College of Obstetricians and Gynecologists. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions on Assembly Bill 360? Seeing none, I will entertain a motion to amend and do pass. So moved. A motion by Vice Chair Wynn, second by Assemblymember Hunt. Is there any discussion on the motion? Seeing no discussion. Assemblymember Hafen.
Thank you, Chair. And again, I want to thank the sponsor for the amendment. I believe this has satisfied my concerns, but I'm going to vote this yes out of committee today, but I did want to reserve my rights to see the final language just to make sure it comes out. But I did want to thank the sponsor again.
Thank you. Any other discussion on the motion? Seeing none, all those in favor say aye. Aye. Those opposed, nay. Motion carries. Thank you so much. We will give that floor statement to Assemblymember Goulding. Thank you. Next on our agenda, we have Assembly Bill 380, which revises provisions relating to mobile crisis teams. Mr. Florence.
Thank you, Chair. Assembly Bill 380 was sponsored by Assemblymember Edgeworth and Senator Steinbeck, and this was heard on March 24th. AB 380 revises the membership of mobile crisis response teams, removes the requirement concerning the location of these teams, and who may establish one. And there are no amendments for this measure. Thank you, Chair.
Thank you. Members, are there any questions? Seeing no questions, I will entertain a motion to do pass Assembly Bill 380. Motion by Assemblymember Edgeworth, second by Assemblymember Gray. Members, is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries. Thank you. We'll give this floor statement to Assemblymember Edgeworth. Next item on our agenda, members, is Assembly Bill 411, which revises provisions relating to prescription drugs. Mr. Florence?
Thank you, Chair. Assembly Bill 411 was sponsored by Assemblymember Howdigi and was heard on March 19th. AB 411 authorizes the prescribing practitioner of mifepristone and misoprostol or their generic alternatives to request to have the practitioner's name replaced on the prescription label with the name of the prescribing healthcare practice. And there are no amendments for this measure. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions? Seeing no questions, I will entertain a motion to do pass Assembly Bill 411. Motion by Assemblymember Hunt, second by Assemblymember Gonzalez. Members, is there any discussion on the motion? Seeing none, all those in favor say aye. Aye. Any opposed, nay? Nay. If the nays will raise their hands, please. Thank you. Assemblymember Gray, Assemblymember Koenig, Assemblymember Edgeworth, Assemblymember Hafen, and Assemblymember Hibbets. Thank you. The motion does carry. We will sign that floor statement to Assemblymember Majority Leader Howdigi. Next item on our agenda is Assembly Bill 461, which revises provisions governing health care. Mr. Florence?
Thank you, Chair. Assembly Bill 461 was sponsored by Assemblymembers Orntlicker and Backus and was heard on March 28th. AB 461 enacts the Uniform Healthcare Decisions Act and revises provisions relating to advanced healthcare directives. Additionally, this bill requires the Aging and Disability Services Division to implement a program to educate and inform residents about planning for long-term care. Assemblymember Orntlicker proposed an amendment to repeal NRS 449A.400 through 449A.481, which govern declarations relating to withholding or withdrawing life-sustaining treatment. Second, to remove the ability of a default surrogate to make healthcare decisions for an individual who lacks capacity if a guardian has been appointed. And lastly, require a responsible healthcare professional to deal with a patient's healthcare decisions in a culturally respective manner. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions on Assembly Bill 461? Seeing none, I will entertain a motion to amend and do pass.
So moved.
Motion by Assemblymember Nguyen. Second. Second by Assemblymember Gonzalez. Is there any discussion on the motion? Hearing none, all those in favor say aye.
Aye.
Any opposed, nay? Nay. If the nays will please raise their hands. Assemblymember Hafen, Assemblymember Hibbets, Assemblymember Edgeworth, Assemblymember Koenig, and Assemblymember Gray are nay. Motion does carry. Thank you. We will assign that floor statement to Assemblymember Orentlicker. Thank you. And next on our agenda is Assembly Bill 474, which requires the establishment and carrying out of a program to supplement the available food supply for certain persons with certain circumstances. Mr. Florence.
Thank you, Chair. Assembly Bill 474 was sponsored by the Assembly Committee on Ways and Means and was heard on March 28th. AB 474 requires the Division of Welfare and Supportive Services to establish and carry out a program to supplement the food supply to recipients of the Supplemental Nutrition Assistance Program by identifying surplus food and distributing it to recipients at a discount. Assemblymember Monroe Moreno proposed an amendment requiring DHHS to take any necessary action to obtain federal authorization to carry out the provisions of this bill. Thank you, Chair.
Members, are there any questions? Seeing none, I will entertain a motion to amend and do pass Assembly Bill 474.
So moved.
Motion by Vice Chair Nguyen, second by Assemblymember Hunt. Members, is there any discussion on the motion? Seeing none, all those in favor say aye.
Aye.
Any opposed, nay? All in favor, motion carries. We will give that floor statement to Assemblymember Monroe Moreno. That leads us to the next item on our agenda, Assembly Bill 484, which revises provisions relating to the collection of data concerning providers of healthcare. Mr. Florence.
Thank you, Chair. Assembly Bill 484 was sponsored by this committee and was heard on March 31st. AB 484 expands the data that is required to be collected by the Department of Health and Human Services and compiled into a database regarding healthcare providers, and this includes the sex of an applicant, any other jurisdiction where the applicant holds the same type of license, whether the applicant utilizes telehealth in their practice, and lastly, the types of patients the applicant serves. And there are no amendments to this bill. Thank you.
Thank you, Mr. Florence. Members, are there any questions on this measure? Seeing no questions, I will entertain a motion to do pass Assembly Bill 484.
So moved.
Motion by Vice Chair Nguyen. Second by Assemblymember Hunt. Members, is there any discussion on the motion? Seeing none, all those in favor say aye.
Aye.
Any opposed, nay? One nay. Assemblymember Gray. Thank you. Motion does carry. And we will give that floor assignment to Assemblymember Dahlia. Thank you. Do you have a comment? My apologies.
No, no worries. I just, it was a comment on the whole list that was in front of us. I want to go on record as reserving the right to change my bill on the floor, change my vote on the floor, so.
Thank you for that clarification. Okay, that concludes our work session for today. Thank you. Okay, with that, we will now turn the chair over to Vice Chair Nguyen, and I will await his opening.
Okay, we're just gonna give the chair a moment to get settled down there, and then we'll get ready to go in just a second.
Okay.
All right, Chair, we'll have you start whenever you're ready, and of course, you already know this, but please state your name for the record, and please begin.
Thank you, Vice Chair Nguyen. Members of the committee, for the record, my name is Tracy Brown May, and I'm proud to represent Nevada Assembly District 42. With me is Ms. Isabella Anderson. She is my intern for this session and a senior at the University of Nevada, Reno. She is studying political science and communication studies. And also here with us is Ms. Connie McMullen. She's representing the Personal Care Association of Nevada. And with that, I am officially going to turn this presentation over to these two very exceptional ladies who have worked on Assembly Bill 519.
Thank you, Vice Chair Nguyen and members of the committee. As you heard, my name is Isabella Anderson. I'm here to talk about Assembly Bill 519, which creates a separate chapter of the Nevada Revised Statutes governing certain agencies and organizations that provide non-medical services. I'm pleased to present AB 519 for your consideration today. So for some background information, during the interim session, the Personal Care Association of Nevada, or the PCA, presented the Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs with information about how regulations impact the personal care industry.
This presentation covers how personal care services, or PCS, are regulated under Chapter 449 of the NRS, which is the chapter regulating medical facilities and other related entities. This is problematic for the PCA because their caregivers do not provide medical care. Because of this, the caregivers providing non-medical assistance are subject to regulations intended for medical care providers. Connie McMullen will provide more information about the complications this creates for personal care attendants.
Thank you, Isabella. Chairman, Vice Chairman Nguyen, thank you very much, and committee members. For the record, I'm Connie McMullen, CONNIE-MCMULLEN, on behalf of the Personal Care Association of Nevada in favor of AB 519. PCAN, as we are known, is in support of moving personal care agencies to a new chapter out of Chapter 449, the Division of Public and Behavioral Health, Healthcare Quality and Compliance. Providers of PCAs, personal care agencies, are listed in Chapter 449, medical facilities and other related entities, under the category of facilities for the dependent. But PCA is not a facility provider, it is a service provider. Since the industry's inception in NRS about 2004-2005, PCA has been listed under facility for the dependent. However, personal care is not offered to those in the same setting as a hospital or nursing home or other facilities which provide care in a brick-and-mortar setting. PCA offers non-medical, in-home care services by caregivers supervised and trained by a licensed agency under HCQC for the aged and disabled of all ages in their home, wherever that may be. PCA caregivers are trained, background checked, fingerprinted, and provide non-medical activities of daily living services, not skilled care. Regulations regarding training such as cultural competency, infection control, and even immigration that apply to hospitals, nursing homes, hospice, and home health agencies, among others, often do not apply or do so with a limited application. PCA, or rather PCAN, believes the creation of a separate chapter for the non-medical direct care workforce would more appropriately apply and should be extended to include the Intermediary Service Organization, or ISO, and the Employment Agency, both of whom work with placement of caregivers in the home, much like the Personal Care Agency. All do the same service, but with a different approach. PCAN favors the creation of a new chapter, but with retention of the very exact regulations that exist in Chapter 449. The need for this change is logical, coming at a time of increasing demand, caregiver shortages, the rising cost of providing health care, among other things, all of which make it difficult to connect people to services provided in the home. Moving PCA, ISO, and Employment Agency to a new chapter would give the home care industry a better chance to expand and provide better care to the consumer. For this, we ask that you support AB 519, and we appreciate your consideration.
Isabella Anderson, for the record. There are 151 sections of this bill, so please bear with me as I briefly summarize them. A majority of these sections concern the creation of a new chapter in the Nevada Revised Statute. As you heard, personal care attendants who provide non-medical services are currently being regulated as if they do provide those services under Chapter 449 of the NRS. This bill does not propose any changes to the current substantive provisions in NRS 449. Section 1 of this bill proposes to amend Title 40 of NRS by adding a new chapter which will govern the following: agencies providing personal care services in the home, employment agencies that contract to provide non-medical services related to personal care to the elderly persons or persons with disabilities in the home, and intermediary service organizations from the chapter of NRS that generally governs medical facilities and facilities for the dependent. This new chapter, as established by sections 2 through 19, 24 through 49, 51 through 60, 69 through 79, and 81 through 90, consists of provisions for the aforementioned entities to be licensed and regulated in the exact same manner as under current law. Section 147 of this bill requires the Legislative Council to move regulations specifically relating to such entities to a new chapter of the Nevada Administrative Code that corresponds to the new chapter proposed by this bill. Section 147 also requires the board to adopt new regulations to replace the regulations relating to those entities that remain in the chapter of the Nevada Administrative Code governing medical facilities and facilities for the dependent. This section provides that those existing regulations remain in effect until the board adopts new regulations to replace them. As was mentioned, this bill does not change licensing and regulatory laws. Section 148 of this bill clarifies that this bill also does not affect the validity of the following: licenses or certificates to operate the aforementioned entities, certain training completed by the operators, employees, and contractors of such entities, or disciplinary actions taken against such entities. Sections 20, 21, and 50 ensure compliance with federal law by requiring procedures for applicants for certain licenses and certificates. One of these requirements is the necessity for applicants to provide their Social Security number. Section 23 establishes alternate provisions for applicants who do not have a Social Security number. Another requirement is the provision of information that identifies persons who owe certain debts to the state when applicants apply for licenses or license renewal. This will be required by Section 22. Section 65, 69, 74, and 76 carry over similar provisions for intermediary service organizations from existing law. Sections 67, 68, and 80 also require that intermediary service organizations file a surety bond or a substitute for a surety bond with the administrator of the division, and that they undergo a criminal background check in order to obtain a license to operate an agency to provide personal care services in the home. Because this bill proposes a new chapter in the NRS, sections 94, 96 through 104, and 150 eliminate provisions governing the aforementioned entities from the chapter of the NRS, which regulates medical facilities and facilities for the dependent. In accordance with this, sections 93, 111, 113, 117, 118, 120 through 123, 126 through 133, 138, and 146 all eliminate references to the sections which will be repealed by Section 150. Section 151 states that this act becomes effective upon passage and approval. That's everything. So thank you for the opportunity to present this bill today. We're happy to answer any questions you may have.
Tracy Brown May for the record. Before we progress with additional questions, there was one item that was brought to our attention as we were working on amendments, and I'm wondering if we can bring up Mr. Dylan Shaver to just talk about one more issue that needs consideration for this measure.
Thank you so much, Mr. Vice Chair, members of the committee. For the record, Dylan Shaver here today on behalf of Maxim Healthcare. Maxim Healthcare is a provider of private duty nursing services, and I will say that if you don't know what that means, congratulations, because it is typically deployed when there is an infant born with severe health challenges that would normally keep them in the ICU, but would then be provided in the home with services like Maxim's. It is primarily a Medicaid paid service, almost in the entirety, because of the complexity of these cases, is paid for through Medicaid rather than relying on private insurance. They're very, I don't want to say very unique because those words don't work together, but it is a unique and terrible thing for a family to be afflicted with. As Maxim expands itself into a leadership role in this service area, something that has come up in other states is the concept of paid family care. It has not come to Nevada yet, though we have had some discussions about it in this building. And as we have a population that is aging, aging and, children who are born with certain disabilities. In certain cases, it makes sense for the caretaker to be a family member. And what Maxim would hope Nevada could take a leadership role is figuring out on the front end how to do that in this state while preserving a professional and really excellent standard of care for those patients. We approached this, the chair with this concept several months ago, and we've been having conversations with her. And this is not an ideal way to daylight a conversation like that to all of you. We understand that. But we do want to say thank you to the chair and for the committee for hearing this out. For families in this situation where there is going to be a caregiver in the home, like I said, sometimes it just makes sense that that caregiver be a member of the family. Why would we have somebody paid full-time to be there and then send me to work to pay for it, to pay for that person, then just pay for somebody who can uphold a standard of care, make sure they meet the metrics set forth by Medicaid and other agencies, and then keep that family home, keep that family whole and make lives a little bit easier. So to that end, we have asked for the preparation of an amendment. We appreciate the Assembly members' willingness to entertain the idea. The bill in and of itself is, of course, so needed in this state, and so, of course, we appreciate the sponsors as well, willingness to just give us a little bit of language in the last couple of pages. So unless there's any questions, I am happy to return this chair to its rightful owner.
Thank you, Mr. Shaver. Are we done with the presentation? Okay. Well, great job, Ms. Anderson. Another gold star for you. And of course, thank you, Ms. McMullen, for your presentation. Members, do we have any questions? Well, we'll go first with Assemblymember Gray.
Thank you. I appreciate the attempt here at going after, regulating these folks in a different manner. My question is will this affect individuals that are operating in this space that don't necessarily work for an agency, or, how are they going to be held accountable? Because some of them, from what I've seen in the past, are not really somebody you'd want, they're affordable, and that's why they're there, because you really wouldn't want them anywhere else.
I'm going to hand that over to Connie.
You're talking about the private contractors for the employment agencies? For the record, Connie McMullen, on behalf of the Personal Care Association, such as care.com.
Sure, that's I guess that's one way to describe them. Usually there's no contract involved, but yeah.
Yes. It was about 2 sessions ago we put into regulation that they had to be licensed as well. I do not know that all of them have done that. They should be held accountable, but that is not why I'm here. That's another issue, and I agree with you. They will go into regulation, and I hope there is more attention put on that.
Good, thank you. And I wasn't aware that had been done a couple of sessions ago, so thank you.
It is. They have to be licensed first as a business, and then once they're licensed, the information that they had to also be licensed in HCQC was not in regulation, and then we asked for a bill in that regard. We did not get one because of a deadline, and it became that internally. The division did that, and so now when they get a license with the state, it crosses over that they also have to get a license under HCQC. Now, are they complying with the regulations? They should be, and that's another matter.
Thank you so much. I appreciate that.
Assemblymember Tracy Brown May, for the record, thank you so much for that question. That's exactly why we're here, because unlicensed and unregulated caregivers is a concern. So this measure allows us to move this caregiving position into its own chapter so that we can further delineate what the expectations are. Many times these are non-medical positions in that they are family caregivers, right, which is what you heard Mr. Shaver say just a couple of minutes ago. So by providing it its own chapter, we have an opportunity to better regulate and influence the personnel that are working in this sphere. I appreciate the question.
Thank you. Is there any other questions from any other members? Wow. I think this is a trend, Chair. Every time I'm up here, the question is either one or none. So I think we should let me chair more often. All right. Thank you so much for the presentation. We'll head and ask you to step back. We'll go ahead and right now and go to testimony. We're going to go first for testimony in support here in Carson City. And do not see a bunch of folks running up to the chairs. So we're going to go to Las Vegas. And Las Vegas is not coming up either, so we'll go to the phone. AVH, does anyone like to testify in support of AB 519?
If you would like to testify in support of Assembly Bill 519, please press star 9 now to take your place in the queue. Caller, you are unmuted.
Good afternoon. Thank you. Good afternoon, Chairwoman Brown May and committee members for this opportunity to address the committee. My name is Margarita Chavez Sanchez, and I am the Southwest Regional Director for Consumer Direct Care Network. We are dedicated to serving Nevada, supporting nearly 400 consumers and over 440 caregivers. Nationally, we facilitate care for over 96,000 consumers through more than 126,000 caregivers across 14 states. In 13 of these states, consumer-directed services operate under dedicated statutes, reflecting the distinct nature of personal care services these programs provide. I'm here to voice our enthusiastic support for AB 519, which creates a specific legal framework for personal care agencies in Nevada, aligning with national best practices. The main problem AB 519 tackles is the use of medical facility laws for personal care agencies, which are very different from medical facilities. This mismatch leads to unnecessary burdens and expensive compliance, taking resources away from direct client care. For instance, strict documentation requirements and staffing ratios meant for hospitals are impractical and inefficient for personalized home-based care. AB 519 provides a crucial remedy by establishing a dedicated statutory framework tailored to personal care agencies. This legislation aligns Nevada with best practices observed in other states, streamlining operations and empowering agencies to better serve their clients. The passage of AB 519 will have a significant positive impact on both consumers and caregivers. Please join me in supporting AB 519. Thank you so much for your time and consideration.
Vice Chair, there are no other callers in support at this time.
Thank you so much. We'll go now to opposition testimony. Do we have any opposition testimony for AB 519 here in Carson City? Seeing none, we're going to Las Vegas. Again, the trends continue. No one's running up in Las Vegas, so we'll go back to the phone. Back to you, AVH, for opposition on AB 519.
If you would like to testify in opposition to Assembly Bill 519, please press star 9 now to take your place in the queue. Vice Chair, there are no callers wishing to testify in opposition.
Thank you very much. We'll go ahead and go to neutral. If anyone in Carson City would like to come up and testify neutral for AB 519, now is your time. All right. Seeing and hearing none, we're going back to Las Vegas. No changes there either. AVH, we're back to you on the phone for neutral for AB 519.
If you would like to testify in neutral for Assembly Bill 519, please press star 9 now to take your place in the queue. Vice Chair, there are no callers wishing to testify neutral at this time.
Thank you very much. And would you like to do any closing statements? All right, we're waiving that. So thank you very much. We are now closed for the bill hearing for AB 519. We're ready for the next bill, which is AB 522. We'll welcome back our chair to the table and any other presenter she has with her. Please go ahead, Chair, when you're ready.
Thank you, Vice Chair. Tracy Brown May for the record. I'm honored to be here today. To represent Assembly District 42, I want to thank you all for this important opportunity to present Assembly Bill 522 for your consideration today. I don't know if you've noticed, but I'm feeling a little bit out of sorts today. With a 3 a.m. wake up for some reason and some weird nutrition today, I'm feeling like this is the most important time to be testifying and presenting a bill in front of the Assembly Committee on Health and Human Services. Health and Human Services, health is something we all deal with every day, and some days we are stressed and we have anxiety, and some days we feel very secure and able to handle whatever comes our way. Today I'm feeling like I don't have a lot of nutrition. And so there are a lot of really great folks that have helped me get my nutrition today. So if I fumble my words, you'll know why. It was a 3 a.m. wake-up call and then a travel back here. But that's why we're here, right? To serve our community and our constituents. Assembly Bill 522 revises provisions relating to health care. And health care affects all of us every day, whether we need it or we don't, right? Because we all have to go about this world. This bill specifically continues the important work that this legislature has taken in previous sessions to protect insurance coverages for Nevadans. For an example, in 2017, legislation was passed that began codifying the provisions from the Affordable Care Act. That required coverage for preventative services like vaccinations and contraception and screenings for various common diseases. In 2019, legislation aligned Nevada law with federal law by requiring insurers to offer coverage regardless of health status. This prohibited an insurer from denying a claim based on a pre-existing condition. We've done a lot of really good work around health care. Given the uncertainty that we see every day, it's important now, more than ever, that we keep passing legislation that protects access to health care. We all have a right to appropriate, timely, and quality health care. There's a lot of uncertainty in this new federal administration and the apparent attacks on everyday citizens in favor of those who are perceived to be wealthy. It's essential that we continue to underscore everyday people and the importance of health for all of our citizens in Nevada while we continue to ensure access to health care for everyone. Now, I won't walk you through 144 pages of this bill, but I can if you'd like, 144 pages. Instead, I would like to briefly summarize the core features that this bill entails, and it can be broken out into 3 sections, okay? First, Assembly Bill 522 codifies provisions of the ACA that require an insurer to provide coverage for a dependent child under 26 years of age. For my family, that has been essential. This important provision helps to protect insurance coverage for young adults during a highly transitional period of life. 2 of my 3 children are still under the age of 26 and transitioning across the country. Healthcare and health insurance is so important for them. Young adults have the highest rate of uninsurance of any age group. This will help to ensure insurance coverage is protected in our state law. Second, Assembly Bill 522 prohibits a healthcare provider or an insurer from discriminating against a consumer based on an actual or a perceived protected characteristic. This bill defines those protected characteristics as race, color, national origin, age. That's a big one for me. Physical or mental disability, the population that I serve every day. Sexual orientation, gender identity or expression, or sex, including sex characteristics, intersex traits, and pregnancy. And finally, this bill requires coverage for a wide array of preventative care services. The services included in this bill are recommendations from the U.S. Preventative Service Task Force and can be distinguished in 3 groups that are repeated in cycles throughout this bill. You will find that it is repetitive reading if you read every page, which I have multiple times. I would note that federal law already requires certain recommendations from the Preventative Services Task Force to be covered. This bill codifies those requirements into state law. The first group, which can be found for the first time in Section 3, are preventative services recommended for children, such as anxiety screenings, behavioral intervention, oral care, and periodic height and weight assessments. The second group can be found for the first time in Section 4, includes services that focus on maternal and infant health, such as folic acid supplements, preeclampsia prevention, and counseling for perinatal and postpartum depression. The third and final group, which can be found for the first time in Section 5, includes general recommendations for adults, such as interventions for cardiovascular disease, counseling for drug and alcohol misuse, and screening for lung cancer and diabetes. For these preventative services that are being codified into law, insurers are not allowed to require a higher deductible, any copayment or coinsurance, or require a longer waiting period to access these services. There is the bill includes an insurance mandate for all of the following insurance plans: individual health insurance under NRS 689A, group and blanket health insurance under NRS 689B, health insurance for small employers under NRS 689C, fraternal benefit societies under NRS 695A, nonprofit hospital corporations under NRS 695B, health maintenance organizations under NRS 695C, managed care under NRS 695G, and programs for public employees under NRS 287, and Medicaid NRS 422, which is why the bill is so lengthy, because it's repeated over and over. So if you've read this, you know exactly what I'm referring to. That's the bill. It's about health care and caring for our community. So with that, I am happy to stand for questions.
Thank you, Chair, for that poignant reminder that self-care is definitely the foundation for all of us every day. And we can, I use this a lot too when I talk to others to ask about how am I doing. I said, you got to put on your mask first before you can put on for others. So thank you for reminding us of that. So we have a couple of questions. We're going to go first with Assemblymember Nadeem.
Thank you so much, Vice Chair, and thank you, Chair, for the presentation. And I have a couple of questions. One, the first thing is I want to make sure that the current age that the adult children can be enrolled into their parents' program, is it 21, and we are increasing, this bill suggested to increasing it to age 26 years?
Tracy Brown May, for the record, that's a really great question. So currently, my children are able to be covered until the age of 26 under my existing policies. That was something that was enacted federally when, I'm going to say it was called Obamacare. Was that what it was called when it was passed? But so my children are covered under my health insurance policy until the age of 26 currently.
Okay, thank you so much, Chair. And can I have a follow-up question, Vice Chair? Thank you so much. And Chair, my other question is that does it include all the insurances or only Medicaid or the private insurances also?
Tracy Brown May, for the record. Thank you very much. Each one of those sections identifies which types of insurance its coverage is expected to follow this. And so, yes, the idea behind this is that it is the standard that is expected within Nevada for healthcare.
Okay, thank you so much.
Thank you. And next we going to Assemblymember Gonzalez.
Thank you so much. I guess I really have a comment more than a question. I just want to say thank you so much for the work that you've done. As a young legislator here, I'll never forget the day that I got the notice from my parents' insurance that when I turned 16, I would be dropped, right? And not 16, 26. And so, I just really appreciate us codifying this. In terms of also the postpartum depression counseling, I think that's something that we definitely need to be talking more about. I really appreciate that that's included, as well as just mental health for, I think the age in here is 12 or 14. It's a very long bill, so one of those numbers. So I just want to say thank you, and I'm appreciative that we are having this discussion because it is very important, all of those things. Thank you.
Thank you. And next we're going to go to Assemblymember Edgeworth.
Thank you, Chair. Thank you for such an expansive this is really amazing. The bill looks like it is talking about a lot of very, very important things that are really important to the health. So thank you so much for bringing the bill up. I have a question that's probably very basic, and admittedly, I did not read every page of this 144 pages. But typically, when a child becomes an adult at 19, then they're evaluated for Medicaid based on what their income is. And typically, 19-year-olds don't make enough money to exclude them from being Medicaid eligible. So my question is, if you expand this to 26 and then it goes by the family's income, then very possibly that child of 19 may not qualify for Medicaid. So have you any thoughts about, can it be an either or as it benefits the child?
Tracy Brown May for the record. Thank you very much for that question. I sincerely appreciate that. As there are a number of different types of plans, currently my children are enrolled under my medical insurance until this age out, right? So this is currently in effect right now federally. We want to make sure that we had an opportunity to codify it in Nevada state law. So I'm going to say that it would be dependent upon each individual situation. If you have access to health care under a family plan until the age of 26, right, then you stay on your family plan, which is probably a little bit more robust than if you were to go to a Medicaid plan or an entry-level plan, right? So I think that there would be options there. If my children choose to move out of my home, they don't have to stay on my medical insurance, but they have chosen that because I have better medical care for them to have access to. I think that we have lots of kids in different situations that are growing into adulthood, and so the more opportunity we can provide them to stay on a more robust healthcare plan where possible, I think just helps our community be healthier. I appreciate your question.
Thank you. Next, we'll go to Assemblymember Gray.
Thank you, Assemblymember Nguyen. Ma'am, I got a few questions. One, are you familiar with the letter that the Department of Business and Industry submitted?
Tracy Brown May for the record. I am not.
Okay, it just brings up some issues regarding the Affordable Care Act and, changes that may arise, if it's repealed in part or repealed in whole or parts are thrown out by court. But now we've got these entitlements enshrined in state law. What is going to happen? I mean, are those going to be now viewed as entitlements that go above and beyond what's federally required since it's no longer in line with federal law?
Thank you for the question. Tracy Brown May for the record. So first, I would not consider healthcare as an entitlement. Nobody's asking for it to be free. So I just want to be really clear that we're not talking about a social service program that has state or federal money attached to it. We're talking about expectations for healthcare coverage in the marketplace with lots of different health insurance providers, right? Are we okay? We're clear. We're good with that.
We're good with that.
So thank you. I just want to make sure that we're comparing apples to apples. I have not seen the document, but I, historically speaking, states that have policies that are above federal expectations, that policy is then the law of the land, right? And so for me and the population that I serve every day and the children that I have that rely on health care, I feel like it's important to bring healthcare to the forefront so that our fellow citizens in Nevada know that they have access to quality healthcare. So for me, that's what this measure is. It's codifying in Nevada law what is currently federally the law of the land, right? So it has been in effect for a period of time. Thought it was just good policy to bring it here into Nevada. I don't know what I'm sorry, I haven't seen what you were referring to. I'm happy to look at that and consider that as we move forward. But these are very basic measures, from my perspective, that are essential to good quality health care for our families, which is why it's in this measure today. I hope that answers your question.
It does, thank you. A couple follow-ups. How can I say? I've got an adult child that has a career on the outside, living somewhere else. My insurance is better than what it's offered by her employer. Is she still, for lack of better words, is she still entitled to be on my insurance, or could I say no? You got to pay for your own, or how does that work?
Tracy Brown May for the record. That's a really great question. It's going to depend on your policy, your specific policy, and each one of them is going to have a different expectation. My children live across the country, and so as a result, they don't qualify for my Nevada plan. I would have a very high deductible rate for them because they're not in my state, right? But that would be for my plan. When they were still in my home and they were living in my home, then they were covered under my insurance, and they were under the age of 26, which I thought was very important for them. So this is the squishy middle piece, if you will, right? While you have kids that are not, they're adult children, they're not quite out on their own yet, they need access to good quality health care. This allows us the opportunity to do that. And I think every plan is going to interpret that a little bit differently.
And one final question, Chair. Thanks. And it's kind of along the same lines. And it was brought up, and this is actually a question I had from many years ago that I finally got the opportunity to ask. So we talked about prenatal care. So if your child is on your insurance and then they in turn have a child, is that grandchild now on your insurance, or do they go to Medicaid, or what? Where does that road lead to?
Tracy Brown May for the record. That's a really great question. And I'll be honest, I've been up since 3 a.m. So I don't know that I have that exact answer today, but I'm certainly happy to look at that and get that back to you.
Thank you. I really appreciate it. Thanks.
Thank you. Does anybody else have any other question? I think Assemblymember Gray broke my streak on no questions when I chair. So, you know. So with that, if I don't see any other questions, we'll give the chair a break and ask her to step back, and we're ready to take support testimony. We'll go ahead and start here in Carson City. If you're here to testify in support, please come to the table, and all of you come run all at once, you know, so we'll know that, again, now this is changing. I'm breaking my streak here as well as testimony, so this is cool. All right, Ms. Herzig, go ahead and get started. Please state your name for record, and you have 2 minutes.
Vice Chair, members of the committee, Allison Herzig, Director of Government Relations for Dignity Health St. Rose Dominican. I'm here today in support of Assembly Bill 522. We see firsthand the benefits of preventive services as prescribed by the Affordable Care Act, and we support anything that seeks to protect that. So we want to thank Chair Brown May for carrying the bill, and thank you for your time.
Thank you, Assemblymember Vice Chair. My name is Robert Purdy, for the record, P-U-R-D-Y with Silver State Government Relations. On behalf of the American College of Obstetricians and Gynecologists, the Nevada chapter, we're in full support of this bill and want to really extend our thank you to the Assembly member for bringing this comprehensive bill forward. The association is in support of any inclusion of additional maternity care to help those mothers that need it the most, especially those included in Section 15 Sub 1, Section 41 Sub 1, and then especially that in Section 78 of the bill. And we just want to thank again for bringing this forward. Thank you.
Good afternoon, Vice Chair and members of the committee. I'm Annie Vong, ANNIEVONG, on behalf of Nevada Primary Care Association. Nevada Primary Care Association represents federally qualified health centers across the state, and we support this bill. Thank you.
Hi, I'm Julie Smith-Gagan. I'm a parent. My son has type 1 diabetes. If he wasn't allowed to be on my health care, it's going to be a nightmare to get him his own care. It's just a nightmare to get insulin, even with good insurance. So this is really important for parents who have children who have complicated health conditions.
Ma'am, if you could quickly spell your name for the record, that would be awesome. Thank you.
Julie S. Smith, S-M-I-T-H, Gagan, G-A-G-E-N.
Thank you so much. All right, we have anyone else in Carson City like to testify in support of this bill? All right, seeing none, we'll go to Las Vegas. All right, Las Vegas is keeping my streak alive there. Nobody in Las Vegas can testify in support. We'll go ahead and go to the phone for AVH if we have anyone in support of AB 522.
Vice Chair, the public line is open and working. There are no callers at this time.
Thank you so much. We'll go back here to Carson City with opposition. If anyone would like to come up and testify in opposition for AB 522. Seeing and hearing none, we'll go next to Las Vegas. No changes there either. We'll go ahead and go back to the phone. Back to you, AVH.
Vice Chair, there are no other callers at this time.
Thank you so much. We'll go back to Carson City for neutral testimony. Please go ahead and fill up the chairs whenever you're ready, and please state your name for the record, and you have 2 minutes.
Good afternoon, Chairwoman and Committee. Shelley Capurro, representing the Nevada Association of Health Plans.
a 10-member organization, and they operate in both the public and commercial markets. And we'd like to thank you for the opportunity to provide this testimony on AB 522, which proposes updates to the state's health insurance laws related to preventative care coverage and non-discrimination protections. While many of the provisions are mandated under federal law through the ACA, we understand the intent and look forward to working with all of you on ways to avoid the potential for duplication, administrative challenges and costs, and confusion if future federal guidelines diverge from state requirements. Thank you.
Good afternoon. I'm just making sure all the Capuros are up here representing today. Chelsea Capuro here on behalf of the Health Services Coalition. There are many pieces of this bill we support and would continue support if the ACA went away. For example, keeping dependents until 26 is extremely popular with our members. And for example, in the 2017 session, we worked extensively on the bills that codified a lot of the women's health provisions from the ACA into Nevada law. We do have some uncertainties about what this would look like, and I think Ms. Capuro, who spoke before me, outlined a lot of those same things that we would share concerns about. We also have some members who maybe are sitting next to me that could talk, but for example, about retiree-only plans that are not covered under the ACA and not required to be, that this bill does look at. So we'd want to make sure that we're looking at that and taking that into account. And then we also agree with some of the points pointed out by the Division of Insurance in their letter as it relates to Provision 4, which would be a new mandated benefit and some of the unintended consequences. So overall, we want to continue to work on this. We appreciate the chair for bringing this and happy to have further discussions on this.
For the record, Ryan Beeman, representing the Professional Firefighters in Nevada. We represent self-funded, self-administered 501c3 type plans, nonprofit. Like Ms. Capuro said, we do have some of our plans are retiree-only plans, which are not subject to the ACA, which is just for our retirees. So, you know, you don't have all the costs that need to be associated with that to cover our retirees. 2017, 2019, as mentioned, we did work and try to codify all the ACA into statute, and we worked hand in hand to make that happen. And we'll be willing to work at this session with regards to the ACA. Thank you.
Thank you. Is there anyone else in Carson City who would like to testify neutral? All right, we'll go back to Las Vegas for neutral testimony on AB 522. Seeing none, we'll go back to the phone one final time for AB 522.
Chair, the public line is open and working. There are no other callers at this time.
Thank you so much. Chair, would you like to do final closing statement? Well, she waived that. All right. So thank you very much. We'll close the hearing on AB 522, and we'll do a quick recess to welcome our chair back to her seats.
Thank you. With that, we will now open up time for public comment. As a reminder, each person has 2 minutes to provide testimony. Public comment may be submitted to the committee up to 24 hours after the meeting. Is there anyone here in Carson City who would like to give public comment? Please come forward at this time. Seeing no one here in Carson City, no one in Las Vegas, AVH, is there anyone on the telephone line who would like to give public comment at this time?
Chair, the public line is open and working. There are no callers at this time.
Thank you. Members, with that concludes our business today. This meeting is adjourned.